Platelets, also known as thrombocytes, are involved in preventing blood loss. There's almost a 500,000 per microliter, so up to 400,000 platelets per microliter in the bloodstream. There's actually a lot of platelets stored in your spleen. Your spleen can release these platelets upon hemorrhage. So if an individual is losing blood and needs their clotting mechanism kicked into gear, the spleen can release a large number of platelets to help facilitate blood clotting. They're very small, 2 to 4 microns in diameter, because they are just fragments of a cell. What happens in your bone marrow is the pluripotent stem cells will differentiate into megakaryocytes. These megakaryocytes will splinter little pieces. So little pieces break off and become the platelet. These platelets will circulate for a short period of time, 5 to 9 days, and then get removed from circulation, also by the spleen. Their job is to form what's called the platelet plug during the process of hemostasis. Hemo means blood, stasis means stop. So hemostasis is stopping blood loss. They do this by two important mechanisms. One, they clump together to form a plug, a physical plug. They also, and even more importantly, release chemicals. And these chemicals that are liberated or released from the platelet are involved in further mechanisms to prevent blood loss. We've probably heard of medications that are used to reduce blood clot formation. We call these antiplatelet medications. Aspirin can be used, and you may have heard of Plavix, and there are a number of other drugs that block platelet aggregation. Often they do this by blocking the chemicals that are released from the platelet. You'll see in the middle panel on the bottom, there are 3 major chemicals released by platelets: ADP, serotonin, and thromboxane A2. But you'll notice in these 3 panels, it shows how a platelet plug forms. First, there is some sort of damage to the blood vessel. Quite often, that damaged area exposes collagen fibers. Collagen is a very important protein found in the extracellular matrix. Platelets stick to collagen. When they stick and attach to collagen, that initiates their release of chemicals. So the first step is to adhere to the damaged site, platelet adhesion. Second step is called the platelet release reaction, where it releases chemicals. These chemicals act as a positive feedback mechanism to signal in more and more platelets. And you get this temporary plug known as the platelet plug. That's just one step in the overall formation of a blood clot. We're going to look at the other steps as well. So now we're going to take a step back and look at all the steps involved in preventing blood loss. The first step actually happens before platelets even have a chance to arrive and aggregate. It's called vascular spasm. Vascular spasm is when a damaged blood vessel vasoconstricts. Vasoconstriction is due to the contraction of the smooth muscle in the blood vessel. What vasoconstriction does is reduces the amount of blood traveling in that damaged blood vessel. Therefore, it helps reduce just how much blood could potentially be lost. This is a very quick reflex that arteries can do. The next step then would be the platelet plug formation, where you have adhesion of platelets to collagen, release of their chemicals, and then aggregation of more platelets and formation of the platelet plug. Notice the three important chemicals released by platelets. ADP is a platelet attractor. Serotonin helps keep the blood vessel constricted, maintaining a low blood flow. And then thromboxane A2 is another platelet aggregator and vasoconstrictor. So you can see you could design drugs that block these chemicals and therefore reduce the chance of an improper clot formation. The final step is actually the biggest step. It's actually the blood clotting mechanism. The blood clotting mechanism is initiated one of two ways. So there's two pathways. One's known as the extrinsic pathway. The other is known as the intrinsic pathway. Those pathways lead to what's known as a common pathway. The common pathway is used to form a nice solid blood clot. So blood clotting is a very complicated step in hemostasis. We're going to try to keep it as simple as possible, but this is not a very easy pathway to understand. So we're going to do our best using this figure from your textbook. Notice that there's two early pathways, the extrinsic versus intrinsic. The extrinsic pathway is activated when tissue is damaged. This is the most dominant pathway. It happens more often, and it's very quick. When tissue is damaged, there is an important molecule produced called tissue factor, or TF. Tissue factor, or TF, initiates the extrinsic pathway. Other important clotting factors include calcium, clotting factor 5, clotting factor 7, and clotting factor 10. Those are all vital to the extrinsic pathway. The intrinsic pathway occurs when the trauma occurs within the blood vessel or the inner lining of the blood vessel. Hence the intrinsic. So you have extrinsic, which happens in the surrounding tissue, intrinsic, which is within the blood vessel. This is a more complicated pathway. We're going to keep it fairly simple and try to remember that instead of a molecule called tissue factor that kind of initiates the pathway, there's one called Hagman factor, which is clotting factor 12. Calcium is also a very important ion in this pathway. Clotting factor 10, as well as others. Ultimately, both of these pathways activate a common pathway. The commonality happens when formation of an enzyme called prothrombinase is produced. This marks the beginning of the common pathway. This enzyme, prothrombinase, is used to convert prothrombin into thrombin. Prothrombin is an inactive enzyme. We know this usually when an enzyme starts with pro. That means it needs to be activated. So prothrombin is activated into thrombin, which is an active enzyme that converts fibrinogen to fibrin. Fibrinogen is also inactive. When it gets converted to fibrin, fibrin forms a mesh. So fibrin is a protein that forms a very thread-like mesh that starts to capture larger formed elements in order to form a larger blood clot. So it kind of acts as a netting or a mesh. Notice that calcium is required in the common pathway as well. So calcium is an extremely important electrolyte, or ion, used at multiple points in the blood clotting pathways. Individuals that lack calcium might have trouble clotting their blood. We can also remove calcium from blood and prevent it from clotting. This is often done in blood banks. There's other molecules used to remove the calcium so the blood doesn't clot after it's drawn. Many clotting factors are produced by your liver. So the liver is an extremely important organ to have healthy in order to produce a lot of these clotting factors. And then finally, vitamin K is very important for the synthesis of certain clotting factors. So individuals that are lacking proper amounts of vitamin K might have trouble clotting blood. We take advantage of this and design a drug that's used to reduce abnormal blood clot formation called Coumadin or warfarin. Coumadin or warfarin is a vitamin K blocker. It reduces vitamin K for the synthesis of clotting factors. Finally, once you have a blood clot formed, the next thing to do is after the tissue has been repaired, the clot has to be removed. So there's another mechanism called the fibrolytic system. The fibrolytic system helps prevent inappropriate blood clots from forming, but also dissolves the blood clots that were used to give the body time to repair the damage. The important molecules in the fibrolytic system include plasmin, which is the active form of plasminogen, and the enzyme that's used to activate that conversion. That enzyme is called tissue plasminogen activator. So TPA activates plasminogen into plasmin. Plasmin is the enzyme that dissolves fibrin. It gets rid of that mesh so that clot can go away. A couple important drugs that are used are anticoagulants and thrombolytic drugs. Anticoagulants delay, suppress, or prevent blood clots from forming. A couple very commonly used are heparin, which blocks thrombin, and Coumadin, which reduces vitamin K. These drugs are used when individuals are forming inappropriate blood clots, or they're used if we want to prevent blood clots from forming on instrumentation that might be inserted into the cardiovascular system. We can impregnate things with heparin in order to prevent blood from sticking to the devices. So these are very important anticoagulants. The other class of drugs are thrombolytic agents. These don't prevent necessarily, but they dissolve blood clots. So if there's already a blood clot formed, we can use streptokinase or TPA to dissolve the blood clot. Streptokinase was actually an enzyme found in certain types of bacteria. Those bacteria use this enzyme to be able to spread throughout the blood. TPA is a human enzyme we mentioned on this slide. Now we can make that enzyme through genetic engineering and give it to individuals that have a blood clot that might be causing a stroke or heart attack. The final video of this chapter is going to talk about blood typing.